Hey everyone, we've got another specimen today. This is number 1705 in our collection. The heart would have sat roughly in the chest like this, with the anterior surface here, posterior surface towards the turntable, superior head up here, inferior legs down here, left over here, right over here. So that's what we usually do, which is find and identify what appears to be the right atrial appendage, at least externally. And when we look here, we find an appendage that's triangular or broad-based or pyramidal in shape. So we'll go ahead and open up the heart there. And immediately we do find that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. We also do see the oval fossa here, and you can see that there is in fact a defect in the oval fossa, so there is an oval fossa atrial septal defect here. Now when we look for the mouth of the coronary sinus, it's actually difficult to find one, and there are some hearts that do have a lack of a mouth of the coronary sinus, and it is possible this is one of those hearts. But we would generally find the mouth of the coronary sinus somewhere in this area here. Since we also don't have the mouth of the coronary sinus, it's a little difficult to define the triangle of Koch, as it is one of the defining structures, so we won't even try to do that. Then we get into the right-sided atrioventricular junction. Here is the right-sided atrioventricular valve. This valve does appear to have 3 leaflets, 1, 2, 3, and there are septal connections, all consistent with a morphologic tricuspid valve. The ventricle that it opens up into has coarse trabeculations, and we do find that there is a septomarginal trabeculation here, consistent with a morphologic right ventricle. So here's the tricuspid valve, here's the morphologic right ventricle, and then here is the septomarginal trabeculation. And here we actually see very nicely the Y of the septal band. So we see the septomarginal trabeculation and its cranial and its caudal limbs. And within the Y of the septal band here, or between the cranial and the caudal limbs of the septomarginal trabeculation, there is an intraventricular communication or ventricular septal defect. So this is an outlet VSD. When we get up into this right ventricular outflow tract, we find an arterial valve that appears to have 3 leaflets, 1, 2, 3, with 3 sinuses, 1, 2, and 3. Now, I want to point out, as I usually do, that the arterial valves or the semilunar valves do not actually have a true round annulus. The round or oval annulus found in the atrioventricular valves is not what happens in the arterial valves. In fact, what happens here is that there's a crown-shaped annulus, since the fibrous leaflets have some myocardial interleaflet triangles that are present. Right? And so what we consider the round or oval annulus is actually a man-made structure, although that's not to say that's not helpful in surgical or interventional planning. Now, when we look at this outflow tract, we do see that there in fact are coronary arteries that arise from the sinuses, consistent with an aorta and an aortic valve. So we do have an aorta that arises from a morphologic right ventricle, consistent with discordant ventriculo-arterial connections. So far we have concordant atrioventricular connections and a discordant ventriculo-arterial connections. So here's the aortic valve, here's the ascending aorta, and then here is the transverse aorta, and then the descending aorta is here. All right, so now let's go ahead and flip this heart onto its back. Here's the posterior surface of the heart. Here's the left atrial appendage, finger-like. So let's go ahead and open up this atrium here. This atrium is smooth-walled. There are no pectinate muscles that spill outside the confines of the appendage, all consistent with the morphologic left atrium. Here is the atrial septal defect that we saw from the other side within the confines of the oval fossa once again. And then here is the mouth of the left atrial appendage. Here's the left-sided atrioventricular valve. We can see that it has 2 leaflets, one here and one here. This valve does not have any direct connections to the ventricular septum, consistent with a morphologic mitral valve. And then the ventricle it opens up into has fine crisscross trabeculations, consistent with the morphologic left ventricle. When we look at the left ventricular outflow tract here, we see that the only egress is in fact through this ventricular septal defect here, which is an outlet VSD. And note that we've never seen a pulmonary artery or a pulmonary valve. And so it does appear that this heart has pulmonary atresia. And then when we look externally at the aorta here, which remember arises from the morphologic right ventricle, we do see that there was a systemic to pulmonary artery shunt that was placed. So when we look at this heart once again, we're dealing with a heart that has pulmonary atresia, an atrial septal defect, concordant atrioventricular connections, right-handed ventricular topology, an outlet intraventricular communication, and discordant ventriculo-arterial connections with pulmonary atresia, which is status post a systemic to pulmonary artery shunt.